Welcome to the 2,500 people that I know are watching remotely right now. There are some chairs, by the way, guys. There are a few chairs up front for people who have the courage to come up front. Okay? So I want to say welcome to everybody. Thank you for being here. I also want to say a special thanks to the speakers today, the panel members, and obviously all of the moderators. We have an exceptional lineup, which I think we will have a very, very interesting discussion where we can learn from each other and inspire each other about what it is we've got to be doing going forward. You know, and it's wonderful to be in a room of people like this, people that have a special interest in making sure that we do what is right by our communities, that we do what is right for our kids, that we create a better place. To be in the midst of people like you that are looking forward, you know, looking over the horizon, imagining what can be, who are optimistic in the view that despite some of the difficulties that we might be having to overcome, there is a better future. And that over the long haul, because all of these journeys are long journeys, but that over time, we can succeed. So for all of the people who are here and watching, we have that common interest to do something special, to do something different, to challenge the status quo. We're a group of people also who I believe strongly, they believe that nostalgia is not a strategy. We want to go forward, not back. And I want to especially thank the people who are here from the CEO Council, because as many of you know, over the years, we've established a CEO Council of about 60 to 70, almost 70 CEOs from around the country now that have combined together. And we work together on an ongoing basis. Many of us had breakfast earlier this morning, and many of you are here in the room. I won't go through all of the individual names, but these are healthcare CEOs from some of the largest organizations across the country that have come together as a collective, using the power of their collective to make a positive difference here. Because the world we leave to our kids is something that's a special obligation for all of us. And there is wonderful stuff going on around the country. And the new initiatives, the new programs, the new developments, and the new local strategies that are occurring across the country are absolutely phenomenal. We get to experience and learn about these all of the time. So I want to especially thank everybody that has been working so diligently hard for so many years, many for a long, long time, government entities, CBOs, academic institutions, hospitals, doing wonderful work. And I'm looking at some people in the room. I want to say a special thanks, you know, to Greg Jackson, who's right here in the front, and Rob Wilcox, who's here, I believe, who actually led the White House Council on Gun Violence Prevention and Safety in the previous administration. We thank you for your work that you did in that regard. We thank you for working with us over the last couple of years, and we thank you for being here today. Thank you so much. Now, we have to recognize that the environment has changed a little bit over the last couple of months. Things are different. Different perspective, different viewpoint, a little bit of a different vision. In fact, a large different vision. But that is change that occurs, and it occurs ever so often. But the reason we are here does not change. the reason why we come together, why we work together, why we focus on developing better communities, that does not change. That's going to be consistent, especially when we have people who are so committed to doing what's right and what's important for the future. Because this should not be a partisan issue. This is not a partisan issue. It should never be a partisan issue when it comes to the lives and the future of our kids. When it comes to the well-being of families. When it comes to building solid, decent communities. When it comes to safety on the streets. Safety in the schools. Safety in places of worship. Safety in our hospitals. There is an opportunity for common ground. There are things we all can agree on, irrespective of our political persuasion, irrespective of our politics. And one of those common issues that I think that everybody can agree on is that the safety of your kids is important. That we should not be, as a country, be distinctive because we have a statistic where guns are the leading cause of death for kids. That goes beyond politics. That's about common decency. That's about creating the future. So today, as I said at the beginning, we have some very, very interesting panels. And we also are going to have a special announcement today, which we have actually commented on in the past, but this is an announcement, a partnership between the CEO Council, between Northwell and the Ad Council, where we will be launching a national campaign driven by the Ad Council to promote the idea of gun violence prevention and safety. Michelle Hillman, who will be up here presenting in about an hour and a half or so, will actually discuss and describe what that agenda is going to be. This is us coming together with the Ad Council to develop a national campaign, which will begin shortly, to promote what's important here, to promote those things that we can agree on, to promote this concept of a common ground. And these are long journeys. And I like to tell people that success on anything takes time. It doesn't happen quickly. And this is where having a collective of people that believe, that have resilience, that have compassion, that have caring is important. You know, there are headwinds, and there are more headwinds today than there were a couple of months ago. But there are tailwinds. What's the tailwinds? The tailwinds are you, committed people, the tailwind of dedication, the tailwind of promoting that which is right, the tailwind of resilience, the tailwind of never giving up.
That's right.
The tailwind of promoting, even in difficult times, optimism. Because without optimism, we can't get followers. Nobody follows a skeptic over time. Nobody follows somebody who's consistently negative. You follow somebody and you follow people and you follow a cause where you see hope at the end. And there is hope at the end. And the end will be positive. But that tailwind of resilience and a tailwind of the collective of all of us together, working together for something that is so important to all of us. Because quite frankly, it's what we leave behind that matters. We can talk a lot about what we do each day, but what do we leave behind when we're no longer here? A better place. A better place for our kids to live. A better place where communities can respect each other. A place where decency, integrity, truth, and honesty and trust are the key values that we believe in, not the alternative. That's what we leave behind. This gun violence issue is such an important public health issue. It is a public health issue. That's why healthcare organizations are more and more involved, because we all see the results of it, as all of you do, each and every day, and you'll hear some of this during some of the panels. So I would say to you, enjoy today. Be proud of what it is you do. Be proud of what it is you believe in. Learn from one another. Inspire one another. Get other people committed to the cause. And together, there is going to be one result. Over time, a win, where people will have a better community to live in. America has wonderful attributes. It's a great place. We got to preserve it. And it should never be known internationally as a place where guns are the leading cause of death for kids. That's not what ever makes us special. What makes us special is when we say that statistic has been eliminated. That's what will make us special, and that's what we're here to do. So right now I want to have you watch a video. This is a very special video. It was done by Northwell and the Ad Council, and it's going to highlight one of our physicians, Dr. Jose Prince, who is the chief of surgery at the Cohen's Children's Hospital. And after the video, Jose is going to come on stage. So right now, if we could actually show the video, please. Thank you.